This is a study that looked at the effect of fare reduction on low-income transit riders. It was done as a randomized control trial, and I'll say a few words about that, but this is not a technical presentation, and I hope it can be understood by everybody. So the problem we're looking at is that transit fares are too expensive for some people living with low income. And the option for people is to walk or to stay home. And that means that life becomes more difficult because walking may not be easy. And by staying at home, they're foregoing opportunities to get food, go to medical appointments, engage with other people. So a real big impact on their quality of life. And on the other hand, if we consider the perspective of the transit agencies are serving municipalities, so the citizens of municipalities, the politicians and bureaucrats of municipalities. And these people may not be transit users. So when they look to their transit agencies, they may be very pleased to see investments in, for instance, light rail that reduces congestion and reduces emissions. And they may not really be looking to the transit agencies to serve the poor. And a study has shown, a study in the US, that very few transit agencies identify serving the poor as a goal. And on top of that, transit agencies may have targets for user pay. They may aspire to have the user pay for, say, 50% of the cost of transit, reducing subsidies. So these things go together to make serving the poor not really the business of transit agencies, even though the poor may be amongst the heaviest users of transit. So a little background on this study. The region of Waterloo has had a reduced fare transit pass. It's called TRIP, Transit for Reduced Incomes Pass, since 2002. I'm told it was one of the first municipalities to have such a pass. And the issue is that that pass, although it's very popular, has become costly and insufficient. It's oversubscribed, but for some people the pass is too expensive. The pass provides an adult pass at half price, so about $43 right now, and that's too expensive for some. So this study was commissioned by the region of Waterloo and was funded by the Trillium Foundation. And the exciting thing about the study is all the needed players were at the table. We had representatives from Grand River Transit. We had representatives from the community support organizations, the Working Center and Lutherwood. We had people from the university. So I'm at the University of Waterloo, and Marcus Moose, another investigator, is also from the University of Waterloo. And then the Evidence Network is the company that did the data collection and the data analysis and wrote up the report. And I also want to say that people from the region of Waterloo itself were important to the conduct of the study. The study itself ran for the better part of 2 years, from spring of 2017 to this spring, 2019. But the experiment ran for about 1 year. It ran from November 2017 to November 2018. So that's the part when participants were active in the study, buying reduced fare transit passes and completing surveys. So next I have a very quick video. It's just about 1 minute to explain the study.
The Region of Waterloo Transit Affordability Study. Are you living with low income and want more affordable access to Grand River Transit? We're working on a solution. We want to test different affordable passes to see what works best. People living with low income can take part. Here's how it will work. The study will last 1 year. Every 4 months, you will be asked to complete a survey. The surveys will ask you questions about who you are, your travel habits, and your family income. After each survey, some people will be randomly selected to purchase discounted GRT passes. There are 4 discounted passes you can choose from. An off-peak pass for $23 a month, a 20-ride pass for $25 a month, a combo pass for $48 a month, and an unlimited pass for $65 a month. Not everyone will be selected for discount passes, but you will have a chance each time you complete a survey. And everyone who does all 4 surveys can purchase their discounted pass for 5 months after the study ends. Your participation will help more people get access to affordable transit. To sign up for the study, visit the Working Centre, Lutherwood, or attend one of our information sessions. Registration deadline extended to October 31st. For more information, visit grt.ca/transit study. This study has been reviewed and received ethics clearance through the University of Waterloo. These special reduced fare transit products have been designed for the purposes of this study. There is no commitment by GRT to offer them beyond the study period.
So that gave you an overview of the study, and now I'm going to dig into it a little. So here are our research questions. First of all, we wanted to know what the reduced fare product preferences of low-income transit riders were. That is, did everybody really want a full-on adult pass at half price? Or did other people have preferences for a lower-priced pass that perhaps offered less flexibility? And second, how price-sensitive are low-income transit riders? There's a lot of data on the overall price sensitivity of transit riders, but not much data at all on this particular price sensitivity of people living with low income. And then third, what are the effects of fare reductions on transit usage and quality of life? Because it would be great if these transit reductions really were transformative. Okay, so this is what's known as a logic model that basically explains what we're thinking. So our idea is that if you look at the left, there's certain inputs, and these inputs lead to immediate outcomes, and those lead to short-term outcomes, and those in turn lead to medium-term outcomes, bearing in mind that we only have a year to work with. So the input was these reduced fare transit passes. And for them to have any effect, the first thing that has to happen is that people living with low income need to be more likely to buy a transit pass. If they don't buy these transit passes, then nothing's going to happen downstream. Next, the transit passes have to have an impact on travel behaviors. They actually have to ride the bus. And then if they do, it's hoped that by riding the bus, their quality of life improves. Maybe they are able to buy better food, engage more with people, maybe get a job, go to job interviews, whatever. So this is our theory about how things are supposed to work. And this image explains a randomized control trial methodology. So this is a technique that's widely used to test drugs. So the treatment group of patients gets the new drug, the control group of patients get a placebo, and the assumption is that the treatment group and the control group are very much like one another, and the only difference between the two groups is having the drug. Now, in this case, the drug turns a little red guy blue. And so you can see that it has a differential impact on the treatment group versus the control group. So in the treatment group, only one guy turned partially blue. But in the control group, 3 guys turned partially blue. So I didn't create this diagram. This is a little bit bizarre because it shows that the treatment group was less affected by the drug than the control group was by the placebo. But the idea is that these two groups, because people are randomly assigned to the treatment and the control group, these two groups are alike, and so any difference in their outcomes is attributable to the treatment. And in our case, the treatment is a fare reduction. So that's what we're looking at, if that particular intervention has an effect or not. So we had 4 different reduced fare transit passes. It took a lot of work to get to these 4 reduced transit passes because the people around the table had different objectives. Grand River Transit didn't want to lose too much money or set up too much of a precedent for a very low-cost pass. And the people at the community support organizations wanted a very low-cost pass because they were very sensitive to needs of these low-income people. And then those of us from the university wanted a variety of passes, and we wanted them to be appealing enough that we would be able to find a measurable effect, because if the passes weren't attractive, then we would find no effects and the study would be a waste. So all of those put together, and we held 5 focus groups to see how people were feeling about these passes, resulted in this selection of 4 different passes. And basically, each pass received a subsidy of between $21 and $26. So the most, let's say, controversial pass was the off-peak pass that allowed people to ride during midday. And that was the cheapest pass for riders. It only cost them $23. And GRT estimated its value at $46. Then there was a 20 ride pass, which is just a bulk purchase of rides, and that cost $25 to the rider. There was a combo pass, which was both the off-peak pass and the 20 ride pass together. That cost $48. And there was an unlimited pass, which is like the trip pass that had been previously offered, but instead of being offered for half the adult fare, $43, it was offered at a higher cost of $65. So we wanted to see if that would be appealing. And so in coming with these estimates, we had to consider whether or not the experiment would be a success. So there was basically 4 chances for purchasing passes and completing surveys. And I'm sorry, there was 4 surveys. People purchased the pass on a monthly basis. But I won't go into detail on this chart, but this just shows us estimating if we had a certain number of participants at the beginning of the study, and we assume that people would drop out of the study, because people always do drop out of studies. And if we assumed a certain rate for dropping out of the study, would we have a sufficient number of participants by the end to get our results? So this is the kind of process we went through for the 4 different passes at the 4 different survey points. So I hope that's kind of clear. But that's just our attempt to ensure there was enough participants. Okay, so recruitment and retention was a real issue. So here's what we did to make sure we had enough participants. First, we publicized the study. We had posters, we had the video that you just saw, we had a website, and we held 14 information sessions to describe the study to potential participants. And these information sessions were held at locations that were convenient. And then what we did is we enabled participation. You know, not everybody was comfortable with filling out the survey, for example. So we had people helping people fill out the survey. Other people were very comfortable and just filled it out at home using the internet. But some people needed to come to the community support organizations, the Working Center and Lutherwood, to get help. Arabic was the second most frequently spoken language after English, so we made the survey available in Arabic. And we provided numerous email, text, and telephone messages to participants to let them know that a survey was coming up and to remind non-respondents to complete the survey. So there was a total of 4 surveys, and they were spaced 4 months apart. So one in November 2017, one in March 2018, one in July 2018, and one in November 2018. We also incentivized participation. So at each survey, at the first survey, we allocated more people to the control group than the treatment group. But with each survey, people had a chance to be put in the treatment group, because usually if people are going to drop out of a study, it's because they're in the control group and they're not seeing any benefit. So we gave people a chance to be added to the treatment group at each 4-month period. Also, when the study was concluded in March 2018, we allowed every participant in the study the chance to purchase the pass that they had selected for 5 months after the study. And so this meant that they didn't lose this benefit in their lives. And also it gave the regional counselors time to figure out what to do in terms of serving these people after the conclusion of the study. Also, for people who had to come downtown to fill out the study at the Working Center Lutherwood, we gave them a $20 grocery store coupon and 2 bus tickets, so to compensate them for their travel. So there was a lot of people involved in this effort, and it took a lot of time, but in the end, we had just over 500 participants in the study. Okay, so an important question is, does our sample of 500 participants reflect the low-income people living in the region of Waterloo? And the answer was yes. We looked at about 20 different variables, and we had data on the participants in the study and data on people living in the region. And in terms of age and gender and work and marital status and where they live, all kinds of things, the sample reflected the population very well. But in this important respect, and that is how they get around, our participants are essentially bus riders to a greater degree than the population. So you can see in the chart on the left in blue, the people in our study, most of them use public transit, whereas the low-income population, public transit's not the most frequently chosen mode of transit. It's by private vehicle. So we were studying essentially people that wanted to ride transit. There's 2 other ways in which our study sample differed from the population, and that is we had more immigrants, judging from their citizenship, their place of birth, and their language spoken. And our sample was in worse health. We asked about mental and physical health, and our sample had greater health challenges. But the biggest difference was in this fact that we were working with people that use public transportation. We have a lot of fine-grained data on their transportation needs. So this shows how often the people in the study do these 20 things. So it's ranked by which items are performed at least multiple times a week. That is, multiple times a week, daily, or multiple times a day. So on that basis, the most frequently conducted activity is go to work. So you can see that about 40 or maybe more % of the study sample goes to work at least multiple times a week. And the next most is dropping off children, then engaging in physical activities, and so on down the list. So we tried to understand what these people's need for transportation was, and then how they fulfilled that need. So our first research question was, what kinds of reduced fare passes do people want? And so you can see that the most popular pass was the unlimited pass, despite the fact that it was not $43 like it had been offered under the TRIP program, but it was now costing $65. So even at that higher price, it was the most popular pass. Having said that, there was a number of people that chose these less flexible passes, the off-peak pass or the 20 rides pass. So if someone is really low income, very price sensitive, and maybe quite vulnerable, and so they don't travel much, these passes are a good option for them. But it shows that the sample's quite diverse. And that's just reminding you, it's the same slide that I showed you before, of the cost for these passes. Now, when transit researchers study the price sensitivity of transit riders, they refer to that as the price elasticity of demand. And the idea is that if you change the price, how much does demand change? And so the way it's formulated is, how much does demand change if you increase the price by 1%? And the table on this chart shows previous findings. So first of all, you'll notice that all the previous findings are negative, and they're all between 0 and -1. So the idea is that if you increase the price by 1%, then on average, you'll get about, let's say, 0.5% less rides on transit. And these estimates vary. One of the factors is how long the price increase has been in effect for, and that sort of thing. But it's important to notice that if you increase the price, you're going to reduce ridership. So then, of course, in our case, where we reduce the price, we expect to see an increase in ridership. And the question is, is the magnitude of the change the same as what's suggested by this table? That is, if we reduce the price by 1%, does ridership increase by 1%? So because of we had this experimental data, we were able to look at that. So this is a table where we look at, if I just go down the column on the left, what we're looking at is the change of demand. So we look at the proportion of the treatment group that buys a pass. That's the people who get to buy it at a reduced price. And we compare that to the proportion of the control group that buys the pass. And so we get the change in demand, which is delta D, the change in demand. And then we look at the change in price. So how much is the cost of the pass to the control group, the regular price? How much is the cost to the treatment group? And we get the change in price, delta P. And so we divide the change in demand by the change in price, and that's the line that's circled in the fuchsia colored ellipse. And you can see that for a 1% increase in price, we get a much more substantial decrease in demand. So it's greater than all the estimates on the previous chart. And if you look at the extreme right, the people who chose the off-peak pass, they were choosing this pass because they're very price sensitive. So the price sensitivity is quite outside the ranges that are customarily stated. And that makes sense. These people are poor, and when you're poor, you're price sensitive. So, and these numbers also make sense insofar as the cheapest passes, the people who bought those cheap passes were more price sensitive than the people that bought the less cheap passes. And that's shown on this chart here. So the cost of the pass is proportional to the price elasticity of inversely proportional to the price elasticity of demand. So the chart shows both lines decreasing, but the left axis, which shows the cost of the pass, goes from 70 to 0, and the right axis, which shows the price elasticity of demand, is negative. It goes from 0 to -5. So that provides more confidence on our data because it makes sense. Low-income people are price sensitive. So I know that the general estimates of price elasticity of demand are like -0.3 or -0.4, and those numbers just don't capture the price sensitivity of low-income people. Okay. Next, we wanted to look at the effect of transit passes on transit behavior and on quality of life. And so we looked at the effect of transit passes on the frequency of use of public transit and the range of transit purposes. And in both those cases, we found no effect. So what that says that is, if you reduce the cost of transit by between, say, 25 and 50%, people don't go out more often, and they don't change their life and do different things. But what they do, shown with the green tick mark here, is they use the bus more frequently. And then in terms of quality of life, we had a specialized measure of quality of life, and that's the ratio of time spent on activities to time spent on transit. So basically, if you're, well, I'll just speak for myself in Waterloo, I can zip around in no time at all. And so I spend most of my life doing the things that I intend to do, not in transit. But some of you may live in Toronto and spend a much higher proportion of time in transit than you spend on activities, and that has a penalty in terms of your quality of life, as I'm sure you know. Anyway, so we do see that the transit passes do affect the ratio of time spent on activities to time spent on transit, but in our study, which was only 1 year long, we saw no effect on people's health and no effect on people's income, unfortunately. So I'm just going to give you a few more details about this. So in terms of the effect of fare reductions on the likelihood of purchasing a transit pass, so we put a lot of variables into our regressions, our statistical analysis, so that we were controlling for all kinds of things. And you can see in the top line that's circled in fuchsia that there is a treatment effect that's indicated by these stars. So with a high degree of reliability, we can say that if you reduce the fare, people will buy a transit pass. Now, in terms of the effect of these transit passes, and I should specify, what we're measuring here is the effect of a transit pass, not the cost of the transit pass. Some people in the control group bought transit passes at the full price. That's commonly referred to as contagion in a trial of this sort. They're kind of screwing up your trial. So we had to take that into account. So we're looking at the effect of owning a transit pass, which becomes more likely if there's a fare reduction, but this is measuring the effect of the transit pass. So again, circled in fuchsia in the top row, we can see that in models 1 and 3, we look at those people who have a pass versus those people that don't. And in both cases, we see in model 1, they're more likely to use the bus, and in model 3, the ratio of activities to transport is higher. And then in models 2 and 4, we're looking at a different measure of the treatment. We're looking at the value of the pass, and again, we have the same effect, that these people are more likely to use the bus and have a higher ratio of time spent on activities to time spent in travel. And again, we controlled for a number of variables. So we're pretty confident in these results. Okay, so overall, just to summarize the findings, we found that low-income transit riders are diverse. Some are very active with jobs and children, and others are less active. Their preferences for passes varies. 71% bought the high utility passes, the unlimited pass or the combo pass, and 29% bought restricted passes, the 20 rides pass or the off-peak pass. The fare reduction averaged 37% across all passes, and interestingly, only 63% of treatment group participants bought passes. Now you remember that almost all the people in our study were transit riders, and although the treatment group was more likely to buy a pass, only 63% of treatment group participants bought passes. So we can estimate with our price sensitivity data that for 80% of the treatment group to have bought a pass, that's the fourth bullet, the fare reduction would have had to average 48%. So the fare reductions were in that sense insufficient. And then we have these estimates of the price elasticity of demand that vary depending on which population you're looking at, from negative 1.23 to over negative 4, indicating greater price sensitivity that is in the literature. And finally, transit passes were associated with a greater propensity to use the bus and a higher quality of life in terms of the ratio of time spent on activities to time spent on transit. And that's because the alternative for these people is walking. Our study does suffer from some limitations. In particular, we don't know why the effects weren't greater. It may be that the price reductions were insufficient. It may be that the quality of service was insufficient. That, you know, if the transit is not going to where you're working, let's say on the outskirts, or it's not going there. You know, one of our participants was able to take the bus to work at 4 p.m., but he wasn't able to take the bus home after midnight. Then it doesn't matter how low the fare is if the bus isn't going. And it may not have been either of those two things. It may have been that the participants in the study weren't capable or interested in being more mobile. Our results pertain to transit riders, not to all people with low income. And the results will be different in urban areas with more developed transit systems. So the conclusion is that fulfilling the mission of providing transportation to all citizens requires special attention to people living with low income. They won't be served without this special attention. These people have diverse transportation needs. They may be dependent on transit. They may not be able to pay the cost of public transportation, and they can be highly price sensitive. Cost isn't the only issue, and we didn't look into this, but the literature is looking at alternatives, ride sharing, bus hailing, volunteer driving, and so on. So that may be important, and it may be very important for transit agencies to develop a capacity to experiment with these things. I just want to say again that there was an awful lot of people involved in this, people from the region of Waterloo, people from Grand River Transit, people from the Working Center, Lutherwood, the University of Waterloo, and from the Evidence Network. And funding for this study was provided by the Trillium Foundation. So thanks very much for listening.